Okay, we're back in the studio now, and we're going to take our smile design images. I take this on every patient. It's about 7 and an optional image or 2 when I design a case. And I realize you would work in an operatory, but we're set up in a studio so we can film this. We work in a very small space, or you can work in a very small space. So I want you to notice that Karina, our patient here, she's sitting in a assistant stool, and I'm sitting in a doctor stool. We brought these from the office. And that's normally how I would do this photography. I'm taller than most of my patients, so I would sit in the doctor stool. I'll have the patient sit in the assistant stool. If I'm treating somebody that's taller than me, I would reverse that. And what becomes very important as we go through this is the calibration of these images. We want them to have a consistent magnification ratio and a consistent composition because I'm going to do a digital smile design with these images, or a Photoshop smile design, I like to call it. And then also I have something to talk to other members of the team and the patient with, and just as importantly, to communicate to the ceramist. Now, I like to do most of my photography, dental photography, with this setup here. I use a dual point flash system. This is the R1C1 flash. If you're a Canon user, let me try and hold it this way so you can see. If you hold it maybe this way better so you can see. If you're a Canon user, they have a dual point flash system. They have a hardwired and a wireless. The hardwired is MT24EX. The wireless is 270EX. So you can do the same thing with either system. Image number 1 is going to be full face smiling or full face lips relaxed, whichever one you want to take first. I always like to take the lips relaxed one first. So I just get the patient to say like that, just look at him. If she's nice and relaxed, perfect, I'm not going to say anything. There's my image. I want it, and I'm going to focus it myself. I don't want the camera to focus, so I'm going to do the same thing with the next image. And let's go ahead and take an image, and then we need to look at the screen over here and see, did we get what we were looking for? Now, Karina's shaking her head because this isn't exactly a flattering image, and actually great. Okay, because actually I want my pre-op images to not be perfect images. I want to see what I want to see so I can talk to the patient. And then when we do our post-op portraits, to have a significantly better image. So what I'm looking for in this image is how much tooth structure shows when her lips are relaxed. Reveal, some people call it. And we know we'd like to see somewhere between 2 to 4 millimeters. For younger females, probably closer to 4. And you can see that we see it there. And so that's lips relaxed. And now we want to get a lips smiling view at the same magnification ratio. So I'm going to zoom in and out, say cheese, smile, there we go. Take a picture, and let's see what we get over here and see that we got everything we're looking for. Yeah, we did. All right, so those are 1 and 2 image now. Now we need a way to calibrate the images or rotate the images, because we're going to take close-ups now, and we're going to do what I call a digital incisal plane, DIP for short, so that we can have a master image that we can rotate all of the other images to. So we're going to get Johan's help for this. If Johan, if you could come in, please. And so Johan is going to give her some cheek retractors, and actually we'll have her hold the cheek retractors for us first. Great, so just go ahead and give that to her. And we're going to shoot that same shot, the same full face shot, cheeks retracted in, please. And what I want you to do is close and touch your teeth. Okay, Karina, I want you to just rotate your head 1 degree that way and kind of split the difference back right there, and just head back just a tad. Okay, right there. So what I'm trying to get her head is in the postural rest position. And we're taking this view, and when you take this view, the teeth should only be about 2 millimeters separated. When someone smiles, their teeth separate about 2 millimeters. Okay, so here we go. Make sure I've got the right f-stop, and I take this picture here, and then what I can do is rotate every image to this particular smile. So now I know her head's straight up and down, and even if it wasn't straight up and down, I could rotate this image in Photoshop to get it straight up and down. Then I can overlap every other image that I take to that, zoom in or zoom out, and essentially correct any camera rotations that I made in the next images I'm going to take. Great. Okay, so let's recompose here. Now I'm going to get your help, Karina. We're going to move in. So that's image 1, 2, and 3 of Smile Design. Now what we're going to do is change our flash position pretty much to next to lens, like we talked about a little while ago. Okay, I'll rotate it that way actually. So what we want to do now is we want to shoot down the buccal corridor and look at her teeth without her lips there. And what we want to do then is put the lips on top. Okay, so these are going to be images 4 and 5. And since we're doing a close-up view, we're going to do it about the highest f-stop. So I'm going to rotate this up to the highest f-stop, and it happens to go up to about f36. Now I happen to know on this camera that to see all of the teeth, it's about 1.3 or 1 to 3 magnification ratio, so I'm just setting my lens here to the 1 to 3 magnification ratio. The most important thing is the composition. The composition is I want to see all of her teeth at this point in time. All right, so Johan, if you could come in and help me just a little bit. Okay, head back there a little bit. Karina, if you could hold the camera. Really appreciate it. Thank you. And what I'm going to try and do, so close down, bite your teeth together. So we're going to pretend we're taking a picture. Click, click, click. I'm going to take that picture. Separate your teeth just slightly, okay? And then pull those cheek retractors out and smile without moving. Pull the cheek, yeah, you take the cheek retractors out right now. Go ahead and take them out and give me a big smile right there. And that's what we're going to do. We're going to take pictures with the cheek retractors in, then have you remove the cheek retractors and take those pictures. Now, you might be looking at the video here and wondering why she needs veneers. Actually, Johan had done a bonded aesthetic prototype on her with some composites. So did a beautiful job. So we've designed what we're going to do with ceramics here. Okay, great. If we could put those cheek retractors in, please. And again, so I'm going to have her bite all the way down, and then I'm going to make sure her head's relatively straight up and down there and separate two. Perfect. Bite all the way down again and separate 2 millimeters, because when you're smiling, you're separated about 2 millimeters. Okay. All right. So we're going to take this picture here, and I usually take 3 without looking away. Okay. So I'm going to do that. I'm going to do what I do clinically, so you can see. Okay, now Karina, what I want you to do, don't move your head, take the cheek retractors out. Give me a big smile now. Say cheese, okay, now just relax and give me a big smile. You're not giving me the normal smile. Separate your teeth just slightly, say cheese, give me a big full smile, think of something funny. I know I'm not funny, okay, great, there we go. Let's try and get that. So she's not really smiling like she did before for me. There, that's a little bit better. Big cheese, great, great. All right, that was it right there. I think we got it on the last one. All right, so here's what we're doing. Let's come over, let's zoom in on the screen, John, here. All right, so these are the first images that we took right there with the cheeks retracted. I'm going to get rid of that menu right there. And then we did those first with the cheek retractors in, and then we did these second with the cheek retractors out. And the reason, what I'm trying to do is get these images to relatively overlap. They don't quite perfectly overlap, but they're the same magnification ratio, so I can move them easily in Photoshop to overlap them. All right, and the reason why I do the cheeks retracted first is so that if the patient has to put the cheek retractors in after you've made the full face smiling or lower 1/3 smiling, what happens is they move too much. So again, the point was you have the cheek retractors in first and take those images. All right, so those are the main images that we're going to take for our smile design.